Good day, everyone. Welcome to my YouTube channel, Everything Medical. On today's video, I'll be treating the anatomy of the shoulder joint, that is the glenohumeral joint. It is a vital joint in the upper limb. Because of the wide range of movement of this joint, it is known as the most mobile joint in the human body. But it is as well the weakest joint in the human body. And it is the easily dislocated joint in the body because the head of the humerus, which forms its articulation, is 4 times the size than the glenoid cavity of the scapula. Because this joint is formed majorly by 2 bony surfaces. It's formed by, number 1, the head of the humerus, and number 2, the glenoid cavity of the scapula. So it is the most weakest joint, and it is the most mobile joint, and it is as well the most dislocated joint in the body because the head of the humerus is 4 times the size than the glenoid cavity of the scapula. So as you can see here, this joint is formed majorly by 2 bony structures. It's formed by the head of the humerus, it is formed by the head of the humerus or the glenohumeral head or the humeral head of the humerus and the glenoid cavity. The glenoid cavity of scapula. So these are the 2 surfaces that forms this articulation. But before we'll go further on this class, we're going to be going into the introduction of the shoulder joint. What is shoulder joint? The shoulder joint can be called the glenohumeral joint. As you can see, the glenohumeral. Why is it called the glenohumeral? Because it's between the glenoid cavity of the scapula and the head of the humerus, or the humeral head of the humerus. So gleno is for glenoid cavity of the scapula, while humera is for the head of the humerus. That is why it is called the glenohumeral joint. Why clinicians calls it the shoulder joint, because it is one of the shoulder joint complex, because we have 4 joints that makes up the shoulder joint complex. We have the acromioclavicular joint, the sternoclavicular joint, the shoulder joint, and the scapulothoracic joint. These 4 joints forms the shoulder joint complex. Any dislocation of this joint compromises on the functions of the shoulder joint complex. Okay, so what is the shoulder joint? The shoulder joint is a ball and socket type of synovial joint variety that is formed between the head of the humerus and the glenoid cavity of the scapula. That is just the concept of the shoulder joint. It is a ball and socket type of synovial joint variety that is formed between the head of the humerus and the glenoid cavity of the scapula. So that is the introduction of the shoulder joint. So the next in line we'll be talking on is the type. The type. What type of joint is the shoulder joint? The shoulder joint is a ball and socket type of a synovial joint variety. So it's a ball and socket. Ball and socket type of synovial joint variety. So that is all about the type of joint it is. Recall that it is between the head of the humerus and the glenoid cavity of the scapula. Okay. So the next line is the articular surface. Articular surface. What are those surfaces that forms the articulation of the joint? The articular surface of the shoulder joint is formed by the large round head of the humerus and a small shallow glenoid cavity of the scapula. A small shallow glenoid cavity of the scapula. You get? So it's formed by an articulation between the large round head of the humerus and the small and shallow glenoid cavity of the scapula. As you can see, this is the large round head of the humerus. This is the small and shallow glenoid cavity of the scapula. Good. Now, the glenoid cavity of the scapula is slightly and effectively deepened by a fibrocartilaginous ring known as the glenoid labrum. So here is the glenoid labrum. The glenoid labrum. It deepens the glenoid cavity. You get? So that is why I say that the glenoid cavity is slightly and effectively deepened by a fibrocartilaginous ring known as the glenoid labrum of the scapula. So those are the things that forms the articular surface of the shoulder joint. So it is between the large round head of humerus and the small and shallow glenoid cavity of scapula. So those are the things that forms its articular surface. Okay, so the next in line is the stability of the shoulder joints. The stability of shoulder joint. The stability of shoulder joint are those things that make the shoulder joint not to be easily dislocated except by trauma. So the stability helps it on its mobility, on its circumduction movement, because it's very, very mobile. So there are things that surrounds it that helps it to keep it in place. You get? So the shoulder joint stability is of four structures. There are four structures that form the shoulder joint stability. Number one is the rotator cuff muscle. Rotator cuff muscle. Rotator cuff muscle. Or musculotendinous cuff muscle. One is the rotator cuff muscle or the musculotendinous cuff muscle. Two is the glenoid labrum. The glenoid labrum. While three is the long head of the bicep brachii or the long head of the bicep tendon. Y4 is the coracoacromial arch. So the stability of the shoulder joint is formed by the rotator cuff muscles or the musculotendinous cuff muscle. 2 is the glenoid labrum. 3 is the long head of the bicep tendon. Y4 is the coracoacromial arch. Okay, let's start with the rotator cuff muscles. What are the rotator cuff muscles? They are those muscles that is formed by the bending of or bending together of their tendons. They are formed by the blending together of their tendons. And what are those muscles? They are formed by the tendon of the subscapularis, tendon of the supraspinatus and infraspinatus and teres minor. So the rotator cuff muscle are being formed by 4 muscles, which we give a mnemonic as a seat muscle. As a seat muscle. Seat muscle. S is subscapularis. I is infraspinatus. T is teres minor. And S is supraspinatus. It goes whichever way. Either the supraspinatus muscle, the infraspinatus muscle, the teres minor, and the subscapularis. This is just like a mnemonic to remember the rotator cuff muscles. There are those muscles that tends to pull the head of the humerus medially towards the glenoid cavity of the scapula. And why is it called the rotator cuff muscle? Because it helps the head of the humerus rotating against the glenoid cavity of the scapula. This muscle is very, very essential. It is the chief stability of the shoulder joint. So we call them the rotator cuff muscle or the musculotendinous cuff muscle. They work to pull the head of the humerus medially towards the glenoid cavity of the scapula. So we have the subscapularis, okay, the supraspinatus, infraspinatus, teres minor, and subscapularis. So these are the rotator cuff muscles. Here is the supraspinatus muscle. Supraspinatus muscle. Yes. Okay. Now let's take a good look at the coracoacromial arch. The coracoacromial arch is one of the accessory ligaments of the shoulder joint. Yes, it forms the accessory ligament of the shoulder joint with the coracoacromial ligament. Now, what is the work of this coracoacromial arch? The coracoacromial arch is formed by 3 structures. It is formed by the acromion process, the coracoid process of the scapula, that is the boat, and the coracoacromial ligament. Okay, so here is the acromion process. Acromion process of scapula. This forms the coracoid process. The coracoid process. Why this forms the coracoacromial ligament. Acromial ligament. So the acromion process and coracoacromial ligament in the center and the coracoid process all together forms the coracoacromial arch. What does it do? It prevents the superior displacement of the shoulder joint. So it forms a protective arch above the head of the humerus, thereby preventing superior displacement of the shoulder joint. The shoulder joint does not displace or dislocate superiorly because of the activity of the coracoacromial arch that is being formed by these 3 structures. The shoulder joint is dislocated inferiorly. It does not dislocate either medial or lateral or superior. It only dislocates inferiorly by a trauma or an stretch fall, they say. Okay, so that is all about it. So with this and this forms the coracoacromial arch. And this forms the coracoacromial arch. Forms the coracoacromial arch. Okay, now the long head of the bicep tendon is as well the tendon that helps the shoulder joint to maintain its stability. The glenoid labrum, as we all know, is a fibrocartilaginous ring that deepens the glenoid cavity of the scapula so that the head of the humerus can be placed accurately on the glenoid cavity. Okay, that is all about this stability of the shoulder joint. The next thing we'll be discussing is the ligaments of the shoulder joint. The ligaments of the shoulder joint. The next we'll be discussing is the ligaments. The ligaments. The ligaments. The shoulder joint has 4 major ligaments and 2 accessory ligaments. Major ligaments. You have the number 1 is capsular ligament. Number 2 is glenohumeral ligament. Glenohumeral ligament. Number 3 is the coracohumeral ligament. Coracohumeral ligament. While number 4 is the transverse humeral ligament. Transverse humeral ligament. Okay. Now the accessory ligaments of the shoulder joint, we have number 1 is the coracoacromial ligament. The coracoacromial ligament that helps to form a protective arch which prevents the superior displacement of the shoulder joint. Okay, we have the coracoacromial ligament. Okay, the number 2 is the coracoacromial arch. Coracoacromial arch. So these are the 2 accessory ligaments of the shoulder joint, while these 4 here are the major ligaments of the shoulder joint. So let's start with the capsular ligament. The capsular ligament is all about the fibrous capsule. It's all about the fibrous capsule because it forms a thin fibrous layer of the joint capsule that surrounds the glenohumeral joint. It is attached medially to the margin of the coracoid process of the scapula and laterally to the anatomical neck of the humerus. So this is the fibrous capsule. Here and here is the fibrous capsule. The fibrous capsule of the shoulder joint. Okay, now the glenohumeral ligament, we have discussed the capsular ligament. The next is the glenohumeral ligament. The glenohumeral ligament of the shoulder joint forms 3 thickening. It forms 3 thickening, you get, of the anterior aspect of the joint capsule. It forms 3 thickening of the anterior aspect of the joint capsule. What are those 3 thickening? The superior, middle, and inferior glenohumeral ligament. This ligament supports the fibrous capsule of the shoulder joint. It is not seen exteriorly. It is seen in the interior aspect of the fibrous capsule. So it forms a 3 thickening on the anterior aspect of the fibrous capsule of the shoulder joint. Okay, the coracohumeral ligament, from the name coraco and humera, that is between the coracoid process of the scapula and the humeral head of the humerus. Okay, now the coracohumeral ligament is a strong fibrous band. It is a strong fibrous band that passes at the base of the acromion process of the scapula and the anterior aspect of the greater tubercle of the humerus. So it is a strong fibrous band that passes along the base of the acromion process of the scapula and on the anterior aspect of the greater tubercle of the humerus. So that is all about the coracohumeral ligament. On the transverse humeral ligament, the transverse humeral ligament is a broad fibrous band that bridges the basipital groove of the humerus. between the greater and lesser tubercle. This transverse humeral ligament converts the basipital groove of the humerus into a canal which lodges the tendon of the long head of the bicep brachii surrounded by the synovial sheath. You get. So it converts the basipital groove of the humerus into a canal so that the tendon of the long head of the bicep brachii can be lodged on that groove, thereby surrounded by a synovial sheath. So that is all about the ligaments of the shoulder joint. That is the major ligament of the shoulder joint. The next we'll be discussing the coracoacromial ligament. The coracoacromial ligament, which is one of the accessory ligaments of the shoulder joint, extend between the acromion process and the coracoid process of the what? Scapula. Okay, recall that it forms a protective arch alongside with the coracoacromial arch to prevent the superior displacement of the what? Shoulder joint. Now, coracoacromial arch is actually the main accessory ligament of the what? Shoulder joint, because it is in conjunction with the acromion process, the coracoacromial ligament, and the coracoid process of the scapula to protect the superior aspect of the shoulder joint with jealousy, because that it plays a protective arch. It provides a protective what? Arch superiorly, so that it will prevent the superior displacement of the what? Shoulder joint, because the shoulder joint does not displace or dislocate superiorly because of the prehensile activity of the coracoacromial arch on the superior aspect of the humerus. Okay, so that is all about the ligament of the shoulder joint. The next we'll be discussing is the blood supply. The blood supply. What is the arterial supply of the shoulder joint? The blood supply of the shoulder joint is, number one is the subscapular artery, two, the suprascapular artery, and three is the anterior and posterior circumflex humeral vessel. So those are the blood supply of the shoulder joint. Okay. Subscapular artery, suprascapular artery, and anterior and posterior circumflex humeral vessel. So these are the blood supply or the arterial supply of the shoulder joint. Next in line is the nerve supply. The nerve supply. What are those nerves that innervate the structures of the shoulder joint? We have number one, the axillary nerve. The number two is the suprascapular nerve. Suprascapular nerve. While number three is the musculocutaneous nerve. So these are the nerves that innervate the structures of the shoulder joint. Okay, the next we're going to be looking at is the bursa of the shoulder joint. The bursa of the shoulder joint. The bursa of the shoulder joint. The bursa. The shoulder joint has numerous bursa. It has numerous bursa, but we are going to be looking at the major ones. Number one is the subscapularis bursa. Subscapularis bursa. Number two is the subacromial bursa, which can be called the subdeltoid bursa. The subacromial bursa. The number three is the infraspinatus bursa. Infraspinatus bursa. Okay, This bursa helps to cushion friction around the structures of the shoulder joint. That is why it's very, very essential. It helps in cushioning mechanism of the structures of the shoulder joint. So we have the subscapularis bursa. The subscapularis bursa protects, or it forms a protective mechanism between the subscapularis tendon and the neck of the scapula. Okay, because it protects the tendon of the subscapularis against the friction on the neck of the scapula. So it is between the subscapularis tendon and the neck of the scapula. That is for subscapularis bursa. Okay, now subacromial bursa, as you can see here, is the largest bursa, is the largest synovial bursa in the human body. It can be called the subdeltoid bursa. Why is it called the subdeltoid bursa? Because the deltoid muscle continues downward. You can see deltoid muscle. Here is the deltoid muscle. Deltoid muscle. So why it's called the subdeltoid bursa is because this bursa continues downward underneath the deltoid muscle. That is why it's called the subdeltoid bursa. So here is the subacromial bursa, which can be called the subdeltoid bursa because it continues downward underneath the deltoid muscle. Subacromial bursa. This subacromial bursa is found between the acromion process and coracoacromial ligament above, and the supraspinatus tendon and the joint capsule below. So it's formed between the acromion process of the scapula and the coracohumeral ligament above, as you can see the bursa here, and supraspinatus tendon and the joint capsule below. That is how it's being situated on the shoulder joint. Okay, I've told the reason behind why it's called the subacromial bursa. I mean the subdeltoid bursa, because it continues downward underneath the deltoid muscle. So it can be called the subdeltoid bursa. It's the largest bursa in the human body, the largest synovial bursa in the human body per se. Okay, now the infraspinatus bursa is actually formed between the infraspinatus tendon and the posterolateral aspect of the joint capsule. So it is found between the infraspinatus tendon and the posterolateral aspect. The next we're going to be discussing is the relation. So the next outline we're talking on is the relation of the shoulder joint. The shoulder joint has four relations. We have the superior relation, the inferior relation, the anterior relation, and posterior relation. Okay, so the shoulder joint is related superiorly to the coracoacromial arch, the supraspinatus muscle, the subacromial bursa, and lastly to the deltoid muscle. So those are the four relations, the four structures that are related superiorly to the shoulder joint. So the next relation is the inferior relation. What are those structures that are related to the shoulder joint inferiorly? We have number one, the long head of the tricep. Number two, axillary nerve. And number three, the posterior circumflex humeral vessel. So this is the posterior circumflex humeral vessel. Circumflex humeral vessel. And lastly is the axillary nerve. These two forms the inferior relation of the shoulder joint and the long head of the tricep as well. So the anterior relation is formed by number one, the coracobrachialis, the short head of the bicep. We have the subscapularis bursa and the subscapularis muscle. So those are the structures that forms the anterior relation of the shoulder joint. The last is the posterior relation. It is being formed by the infraspinatus muscle, the teres minor, and the deltoid muscle. So those are the structures that form the posterior relation of the shoulder joint. So the next outline that we'll be discussing is the movement, because the shoulder joint undergoes several movements. It undergoes a wide range of movement. That is why it is the most mobile joint in the body, because of its circumduction movement, that is a 360 movement of the joint. So we have the movement. Number one movement that it undergoes is the medial and lateral rotation movement. Medial and lateral rotation movement. Number two movement it undergoes is the flexion and extension movement. Flexion and extension movement. The number three movement is the abduction and adduction movement. Abduction and adduction movement. Number four movement which it undergoes is the circumduction movement. Circumduction movement or 360 movement. So these are the movements that is permitted by the shoulder joint. Okay, so the next outline is the clinical correlation. That is the clinical relevance of the shoulder joint. The clinical relevance. The clinical relevance. Number one clinical relevance of the shoulder joint is the dislocation, because it's a joint, it is an articulation, it dislocates. Dislocation. Dislocation. The shoulder joint dislocates inferiorly. It does not dislocate superiorly because of the activity of the coracoacromial arch that prevents superior displacement or dislocation of the shoulder joint. It dislocates inferiorly by an stretch fall or a trauma to the shoulder joint can cause it to do what? To dislocate inferiorly. Number two is bursitis. That is inflammation of the bursa, because there are so many bursa that surrounds the shoulder joint. So those bursa could get inflamed. It is termed bursitis. The number three is frozen shoulder or adhesive capsulitis. Frozen shoulder, which can be called the adhesive capsulitis. It is the tearing of the synovial capsule of the shoulder joint. When it got thawed, it could lead to what? Leakage of those synovial fluid, thereby leading to frozen shoulder. It can be called adhesive capsulitis. So the number four that we'll be looking on is the shoulder tip pain or the referred pain of the shoulder. Why? Because when there's an injury to the diaphragm, the motor nerve of the diaphragm is called the phrenic nerve. And this nerve arises from the muscular branch of the cervical plexus. Likewise, with the supraclavicular nerve that supplies or that give a cutaneous innervation to the upper limb. These two nerves arises from the cervical plexus because it have a sensory branch and a muscular branch. but they come from the cervical plexus as their root branch. So if there's an injury to the diaphragm, it could lead to the referred pain of the shoulder, because the supraclavicular nerve comes from or arises from the cervical plexus. The same with the phrenic nerve. We call it the referred pain of the shoulder or the shoulder tip pain. Shoulder tip pain. Okay, so these are the clinical correlation that is associated with the shoulder joint. Yes. Okay, we have another one, which is the rotator cuff muscle disorder. Rotator cuff muscle disorder. Cuff muscle disorder. Okay, it could lead to the detachment of those muscles that forms the musculotendinous cuff muscles. The musculotendinous cuff muscles, which include the supraspinatus, the infraspinatus, the teres minor, and the subscapularis muscle. So here come the end of this class. I believe you enjoyed the anatomy of the glenohumeral joint as we have discussed earlier. We have been discussing it. Endeavor to watch it to the end, and if you have any question, comment it on the comment section, and endeavor to share it to your colleagues in medical school. Thank you for watching.